Osteoarthritis, OA, is the most common form of arthritis and a degenerative joint disease that primarily affects the cartilage, the tissue that cushions the ends of the bones in the joints. In osteoarthritis, the cartilage breaks down over time, causing pain, stiffness, swelling, and a decrease in the joint's range of motion. OA can affect any joint but most commonly affects the knees, hips, hands, and spine. The symptoms of osteoarthritis can range from mild to severe and typically develop gradually. Common symptoms include joint pain, which is the most noticeable symptom, worsening after activity or at the end of the day, joint stiffness, particularly after periods of rest or in the morning, swelling due to inflammation around the joint, decreased range of motion as the joint becomes less flexible, a grating sensation when moving the joint due to the rubbing of bones, bone spurs, which are extra bits of bone that may form around the joint, and tenderness, where the affected joint may be tender to the touch. Osteoarthritis results from the wear and tear of the joint's cartilage, but several factors can increase the risk of developing the condition. Aging is the most significant risk factor, as the cartilage naturally wears down over time. Previous joint injuries, such as fractures or ligament tears, can increase the risk of developing OA in the affected area. Obesity puts additional pressure on weight-bearing joints like the knees and hips, accelerating cartilage breakdown. A family history of osteoarthritis may predispose you to developing the condition, and certain genetic mutations may influence cartilage durability and joint health. Women are more likely to develop osteoarthritis, especially after menopause, due to hormonal changes that may affect cartilage integrity. Repeated use of a joint in a particular way, such as in athletes or people with occupations that involve repetitive motions, can contribute to OA. Weak muscles around the joint may also contribute to abnormal joint mechanics, leading to additional wear on the cartilage. Osteoarthritis is diagnosed based on a combination of your medical history, physical examination, and imaging tests. A doctor will examine your joints for signs of swelling, tenderness, and limited range of motion. An X-ray can reveal changes in the joint such as joint space narrowing, bone spurs, or cartilage loss. An MRI may be used to get a more detailed image of the cartilage and soft tissues around the joint. In some cases, a doctor may remove a small sample of joint fluid with a needle to rule out other conditions and assess the fluid for signs of inflammation. While there's no blood test for OA, blood tests can help rule out other causes of joint pain, such as rheumatoid arthritis. While there is no cure for osteoarthritis, there are several treatments available to manage the symptoms, reduce pain, and improve joint function. Non-pharmacologic treatments include physical therapy, where a physical therapist can guide you through exercises to strengthen the muscles around the affected joint, weight management, as losing weight can significantly reduce pressure on weight-bearing joints, assistive devices like braces or splints to support the joint, and heat and cold therapy to alleviate pain and inflammation. Medications include pain relievers like acetaminophen for mild to moderate pain, nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen to reduce pain and inflammation, corticosteroids for short-term relief of inflammation and pain, hyaluronic acid injections to provide lubrication, and topical analgesics for temporary pain relief. In severe cases where conservative treatments fail, surgery may be considered, including arthroscopy to remove damaged tissue, osteotomy to relieve pressure on the joint replacement surgery to replace the damaged joint, or joint fusion to eliminate movement and provide pain relief. While it is not always possible to prevent osteoarthritis, steps can be taken to reduce your risk, such as maintaining a healthy weight, exercising regularly with low-impact activities, protecting your joints, avoiding joint injuries, strengthening muscles around the joints, and seeking early intervention if you have risk factors or symptoms. Osteoarthritis is a chronic condition that can significantly affect mobility and quality of life, but with appropriate treatment and lifestyle changes, many people with OA can manage their symptoms effectively. If you experience persistent joint pain or stiffness, it's important to consult with a healthcare provider to develop a personalized treatment plan.